Welcome to the Anatomy Lovers channel. Have you ever found yourself questioning the nature of that persistent throbbing pain in your head? You're certainly not alone in wondering if it's merely a common headache, or something more debilitating like a migraine. Today we're breaking down the evidence-based differences between migraines and headaches, how to recognize them, and most importantly, what you can do about it. Let's dive in. It's important to highlight that around 75% of patients experience impaired functioning during a migraine attack, and about half of them require help from others. This disorder leads to a loss of 20 million working days in England alone. The economic annual impact of migraines is staggering, estimated at 27 billion euros across European countries. First, let's clear up a common myth. Migraines aren't just bad headaches. They're a neurological disorder involving changes in brain activity, blood vessels, and nerves. On the other hand, headaches are a broader term for pain in the head, face, or neck, with tension type being the most common. Symptoms of migraines include often one-sided throbbing pain with nausea, light sound sensitivity, and sometimes aura, flashing lights, tingling. While the headache symptom is dull pressure-like pain, like a band around the head without neurological symptoms. Think of migraines like a storm in your brain. They activate pain pathways and release inflammatory chemicals. So, symptoms go beyond head pain. Let's decode the symptoms. If you experience any of these, it's likely a migraine. The prodrome phase, which happens 24 to 48 hours before, includes fatigue, food cravings, and mood changes. The aura phase, occurring 20 to 30 minutes before, involves visual disturbances, numbness, or speech issues. During the attack phase, you might feel severe one-sided pain, nausea, vomiting, and sensitivity to light or sound. Lastly, the postdrome phase can leave you with hangover fatigue or brain fog after the migraine. And headaches, they're shorter, lasting 30 minutes to a few hours, less intense, and they lack these phases. Here is a quick test to differentiate. If moving makes the pain worse and you need to lay in a dark room, it's probably a migraine. Migraines are often genetic, but triggers vary. Common triggers can be stress, hormonal changes, skipping meals, bright lights, or strong smells. On the other side, headache triggers include muscle tension, dehydration, poor posture, or eye strain. Migraines are linked to cortical spreading depression, a wave of electrical activity in the brain that disrupts blood flow and triggers inflammation. Headaches? They're usually caused by tight muscles or stress. Let's talk about solutions. For migraines, research-backed approaches include acute treatments like NSAIDs such as ibuprofen or triptans like sumatriptan for pain. Preventive medications can be propranolol, topiramate, or CGRP inhibitors. Non-drug options include neuromuscular exercises, which have been shown in studies to reduce tension, and dietary changes such as magnesium supplements and riboflavin, also known as B2. For headaches, you can use over-the-counter pain relievers, stress management techniques, and posture correction. Here is an effective guide to eliminating tension and enhancing your posture, paving the way for lasting pain relief. Embrace these practical strategies to transform your well-being and experience a remarkable improvement in your comfort and quality of life. Just gently hook 2 fingers behind your ears, tilt your chin toward your chest, and hold for 30 seconds. This can really help release some of that neck tension linked to migraines. Next, let's try a side neck bend. Here's how to do it. First, sit or stand comfortably with a straight spine and relaxed shoulders. Lower your right ear toward your right shoulder. Extend your left hand toward the floor, flexing your fingers upward. Hold this position for 30 seconds and really feel that stretch along the left side of your neck. Then, return to center and repeat on the other side. Why does this work? It releases tension in the neck and upper back, which are often tight when you have a headache. Another great stretch to relieve tension is the child's pose. Kneel on the floor and sit back on your heels. Stretch your arms forward on the ground and rest your forehead on the mat. Just breathe deeply and hold for 30 seconds to 1 minute. This pose gently stretches your back, neck, and shoulders, helping to ease built-up tension. Let's talk about posture correction. First, sit or stand tall, shoulders relaxed and back, and tuck your chin slightly. Second, imagine a string pulling the crown of your head upward. And third, make sure to check your posture throughout the day, especially when using screens. This practice helps prevent tension buildup in your neck and shoulders, which are common headache triggers. Now let's work on strengthening those upper back muscles. Here's a shoulder blade squeeze exercise using a resistance band. Anchor the resistance band at waist height and hold the ends. Pull the bands toward your stomach, drawing your shoulder blades together. Hold for 2 seconds, then slowly release. Aim for 3 sets of 10 reps. Strengthening your upper back muscles improves posture, reducing headache triggers from slouching. Finally, we have a relaxation technique called square breathing. Let's try this together. Inhale through your nose for a count of 4. Hold that breath for 4 seconds. Exhale through your mouth for 4 seconds. Hold again for 4 seconds and repeat several times. This technique activates the parasympathetic nervous system, helping to reduce stress and muscle tension that can trigger headaches. If this doesn't help you, you need to know when to see a doctor. Don't ignore the red flags like sudden, severe thunderclap headaches, headaches with fever, confusion, or vision loss, migraines that don't respond to over-the-counter meds, a headache that's difficult to manage. Remember, migraines are more than just a headache, they're a complex neurological event. But with the right tools, you can take back control. If this helped, smash that like button, subscribe, and share this with someone who needs it. Stay healthy with Anatomy Lovers channel, and see you next time.